Without any further delay, it's my honor to invite Dr. Yadin David, Interim President of GCEA, to open the webinar. Dr. Yadin, the floor is yours.
Thank you, Kali Stefano. Very, very nice start for something new that we're going to discuss today. Not only this is the first in a series of webinars that will be brought to you for education and exchange of information, but more so, this is a beginning of a collaborative era in the clinical engineering field, where clinical engineering practitioners from all over will be able to engage, promote, and solve issues, and more importantly, interact with other professions and stakeholders in the healthcare system. This requiring us to make a commitment, because if we want to sit at the table with other professionals, we need to be professional ourselves. And that means characteristics, obligation, code of ethics behavior, and focus on serving those who need us the most. Patients and other stakeholders in the healthcare system would be our priority. We're going to insert several polling questions. And before I start, I would like to ask you to see the following two polling questions that are showing up on your screen. And please take a few seconds to mark the answers that you see here. As soon as we get the responses, we will flash it on the screen. How much do you know about GCEA and its leadership? You have choices. Second question, what is your background? And you have choices there. Let's close the polling question in 5 seconds. And Kaliroy Stavriano, if you have the responses, please post them. And as you can see, very interesting that the first question about knowledge on GCEA is expected. 1/3 is saying that their knowledge is very limited. And about 1/4 is saying that they know a lot. I wonder if the faculty voted on that. The second question, what is your background? You can see 3/4 are clinical engineer, which is excellent. We have about 1/8 managers and some others mentioned as well. Great. Very good information. Let's close it and move in and say, why is Global Clinical Engineering Alliance is important? Well, we have illustrious faculty joining us today to elaborate on the different angle. I will take the overall view of what is the structure and why do we need it. We'll follow up with Stefano from Italy that will talk about National Association angle to joining the Global Clinical Engineering Alliance. Moving to South Africa with Meladen Poluta of looking at the angle of other profession and relationship with other stakeholders, and coming to Tom Judd from the US of demonstrating how can we make the field larger by joining the organization like IFMBE, Clinical Engineering Division, and the GCEA working together to enlarge the size of the pie, if you will. You know, if you have a chest pain and you would seek advice, probably most people will say they're going to look for a cardiologist. Same goes if you have other medical condition like twisted your ankle, you probably will look for orthopedic expertise to consult with. But when it comes to medical technology related issue, your guess might be as good as mine as to where policymakers and decision makers will turn to get their consultation. My question is simple. Will the clinical engineer be on top of the list? Will we make the list at all? We determine in this group of the Global Clinical Engineering Alliance to change that. And with your help, we can make this happen. But there are challenges. That means that we have to become and sustain a profession. We have to educate health and wellness related community groups about our scope of expertise, body of knowledge, and body of practice. We have to advocate that all our members are academically prepared and pursue credentialing program demonstrating forward thinking and ability to solve problem and understand the methodology behind it. We need to strengthen the ability and the capacity to join into engaging with policy, preaching the regulatory and decision maker about safety, quality, accessibility, performance, and effectiveness of health technology lifecycle. The metrology of measuring the performance of those phases need to be explained, clarified, and unified. We need to understand the relationship between patient expertise and the technological tools that are attached to by other stakeholders and used to diagnose, treat, and monitor the disease management process. We need to understand that there are benefits from our involvement at the point of care and need to do research to demonstrate the point, as was mentioned earlier today by Elliot and Jitendra Sharma from India, about can we demonstrate what is the impact on saving life and improving life quality because of clinical engineering expertise. We also need to have representation in national and international body, as listed down below in the slide, and build the recognition and impact through uniquely dedicated clinical engineering structure. Next. That is bringing us to the reason that we felt that to bridge the gap, we need to build this organization called Global Clinical Engineering Alliance, a registered not-for-profit organization and borrowing from the American Constitution, created by clinical engineer, for clinical engineer, dedicated to the clinical engineering field, engineers, technologists, and technicians. We aim to maximize the benefit from the technology and the clinical engineering practitioner expertise for the benefits of patients and their care providers, while minimizing the technology risks and costs. We want to increase the information exchange, build the capacity, demonstrate the expertise, and promote awareness to our field throughout the world. To do that, we need to provide international networking beyond single country, beyond one region. As Stefano is working on the proposed union, the European Federation, it makes sense to have that expand beyond other continents and connect and be more unified in the message we're carrying. The Alliance also created a not-for-profit foundation to encourage what we talked about, conducting studies and research, especially collaborative one with other stakeholders, to demonstrate what is that clinical engineering are doing in improving patient care outcomes. Next. We already have started and achieved some milestones. For example, today we have initiated education program, which consists of both webinar and courses. And you will see at the end of this webinar, the next scheduled webinar of interest about project management. We completed international review of technological innovation addressing COVID-19 needs in low and middle income countries, and under contract with WHO under what known as the compendium document for 2021, which is available online. Together with IFMBE CED, we maintain a COVID-19 vetted publication, and it is available on the global CEA.org website for you to see. Every day we get together and we look at publications that are appropriate and fully vetted to be included in our site. We have already established and posted online the International Recognition Program, an award program that is crossing the world for Collaborative Capacity Building Award that recognize excellence in international clinical engineering collaboration programs. We are leading professional tenets that are required in order to achieve our goal. A global clinical engineering summit every other years. The next one is coming in October during the Global Clinical Engineering Week celebration. The Global Clinical Engineering Day is now expanding to a week because of the participation, and that is contributing significantly to global understanding, because in 2017 we had a participation of about 500,000 watchers to that event in China. We also have the International Clinical Engineering Journal, and you are invited, and as a matter of fact, I believe you're obligated to read, publish, and try to share your expertise through such a good quality journal. And then we have the biannual International Clinical Engineering and Health Technology Management Congress. We are collaborating with IFMB and CED and showing that we do have common professional threshold that we want to achieve. One of them is Global CE Certification Program. And by doing that, we are reaching further and more impactful by doing things in collaboration. You know, a couple of years ago, in a survey that was published in the Global Clinical Engineering Journal in volume 3, issue 2, we asked the question of, do you see a value to an international clinical engineering association? And if you do, would you participate in that? It was amazing to see that 93% of the responses said that they do see a clear value, and 84% said that they will participate and help in its function. This is tremendous response, and that's why we're here today. Next. Because we believe that the vision for our professional future is one voice for all clinical engineering everywhere around the world as professional opinion-making group. We are the only international organization created by, for, and governed by clinical engineers. We present unified voice and act, therefore, as professional organization qualified to represent the common interests of clinical engineering practitioners everywhere. Our flag is one, clinical engineering. There is no chemical engineering, biomedical engineering, nursing, physician. It is our field, clearly bringing it to the attention of other stakeholders. Through this leadership of Global Clinical Engineering Alliance representing each continent on this planet, we intend to create alliances with other healthcare professionals to optimally serve patient and health system interests, to engage with the International Congress of Clinical Engineering, Health Technology Management, and bringing other professions to hold their meeting together with us. We believe that this is a tremendous opportunity, a new era, and unfortunately and sadly, we are just going through a COVID-19 era that taught us that no one is an island, that we need to be better connected for preparing for the next disaster, and to promote the professional education and credentialing standard of our own colleagues, so we will become equal member of the healthcare and the wellness team. Join Global Clinical Engineering because together we can make it better. Next, I put together a list of references. Some of them I referred to during my talk. All these slides and the other presentation are recorded and will be shared with you after the broadcast. Next. And with that, I would like to thank you. I wish I could say toda, shishi, grazie, obrigada, gracias, and all other languages. And I thank you for giving me the opportunity to talk about Global Clinical Engineering Alliance.
Thank you, Dr. Yadin David, for the very informative presentation. Thank you.